All right, let's start going through your list. So tell me why breast size is getting bigger. I bet it's on the board, spoiler. HCS, or you can say lactogen, right? So we'll do the fancy one. HCS, lactogen. Again, what's his job? His job is to increase the membrane glands, prime the pump, we call it. All right. The logic being, if you need to make milk, it's best to have it before you need it. All right. So now, why is the areola getting darker? That's the target. They call it the bullseye. The baby can't see your nipple unless there's a ring, so it's easier to see. But why physically is it getting darker? What makes it get darker?
Melanocytes?
Melanocytes and blood flow. So increase in blood flow, and that also increases melanocyte activity. You know this because one of the other characteristics of pregnancy is the linea nigra, that dark line down a woman's tummy, is because the melanocytes in your skin turn on for some magical reason. And so you get a dark line.
What was that line? Did you tell me what that line was from?
The nigra?
Yeah, like why is it a straight line going straight down the center?
I didn't build it.
No.
And when does it show up?
I think about any time in pregnancy, it gets darker as pregnancy moves along. It's usually darker in further pregnancies than the first one, but it depends. Right, so let's go back to blood flow. Why would you want more blood flow to the mammary gland? What's blood needed from mammary gland? Nutrients. And what do I need nutrients for? To help produce milk. I need more fluid, more salt. So I'm getting more, this again was priming the pump, I'm getting more fluids to the mammary glands so they can make more milk. That's why you physically see them get bigger, darker. That's the logic behind it. More blood flow, more melanocytes because of the HCS.
Was it making more ATP there?
It will be eventually. The cells have to be mitotic. So, urinary incontinence. Alright, I'm pregnant woman peeing every 5 seconds. Let's find that picture again. Let's see. Where do babies? Let's see. Can you find a bladder? There's a bladder here. Can you find it? Where is it? Oh, this smash thing right there. Right. So baby's cramming your bladder into your pubic bone. So now it's about that big. So if you have a small bladder, you have to pee all the time, right? So someone's forehead is in your bladder. Must be great. Right. So hence the problem of urinary urgency is because of small bladder. Crushed bladder, destroyed bladder. Crushed bladder. Constipation. Crushed rectum.
We had also thought about like water supply of baby.
Yes, so there's a little bit of the reabsorption because of the extra blood volume. The most physical reason, though, is there's a rectum back here with someone's head's in it. Right? So it's hard to get stuff to pass, or if we absorb more water, stool gets harder to pass. Right? That's the logic. You're impeding the flow.
Is that the same with the large intestine too? It's also impeding with all of them.
That's the logic of it. Right? Somebody's head's in the way.
Progesterone play a role?
Progesterone indirectly plays a role. Progesterone, I've never heard anyone say progesterone by itself does anything. Whitening of feet positives. Oh, I said it's on the board. That's relaxant. So that one again. Remember, we're trying to relax our cartilages. Cartilage are in your feet. They're in your pubic bones. Right? That's the hips and pelvis and feet. We're trying to relax your joints so you can squeeze out easier. RBCs. That's so 232. Why would your RBCs go up? Give me 3 letters beginning with E. And any with O. EPO, right. That took forever. All right.
I was 232.
That was 232. What made EPO go up? Low oxygen. So why would mom have low oxygen?
You're just giving it to the baby.
That's right. The placenta is taking oxygen out of her body. So mom is running out of air to her kidneys because the baby through the placenta is stealing it. Her body makes more EPO makes more RBCs. So her body's trying to compensate for baby stealing oxygen by carrying more. Right? Remember that takes a couple, about a good month to do that. So this is because the placenta allows the oxygen of mom to enter the baby. Nausea and heartburn. Ooh, I bet you know that one.
Digestive tract.
Yeah, let's see. Where do you think the stomach was? The stomach used to be here. Where is it now? Somewhere up there where your lungs used to be, right? So physically, somebody's feet are cramming into your stomach. Right? So your stomach is smaller, so the acid gets splashed up, you can hold less food, and that then creates the whole nausea, heartburn, sphincter problem. Right? So let's put that. I should put that. Let's say crushed stomach. We're doing that crushed thing here. Right? Somebody's pushing on your tummy, you're going to get nauseous. Yes?
That wouldn't be why you have like morning sickness, though.
No, morning sickness is unknown why you have it.
Okay.
There used to be a hypothesis that.
It's like to protect the baby from.
Yeah, I mean, one hypothesis was just that way you know you're pregnant, you just get sick a lot. Well,
Yeah.
okay, that's fine. One logic was that, well, overnight the baby's still metabolizing, so you get all this waste products in your system, and that's going to make you get sick. The problem is there's no correlation between morning sickness and fetal waste.
Oh.
Right? It's not always in the morning. Not every woman has it. Not everyone has the same amount. So it's one of these things. Who knows?
It's like the same logic behind like why your sense of smell kind of gets sensitive.
Yeah, you have to smell your baby, so the brain up-regulates the chemoreceptors in the nose, so you can smell your baby much better.
Smell your baby once it's born.
Yeah.
Oh.
Oh, only farmers know this. Mammals only know they're young by smelling them. If you rub the afterbirth from a calf on another calf, the mom will take the second calf because it smells the same as the first calf. Right? But humans do the same thing. You can smell your baby better than actually looking at them. You know that? Worth the story. They did a study in England. I don't know how they got with this. They took mothers, blindfolded them, put their newborns randomly in a room as they find them. Talk about neurotic, right? They all got it right.
That's weird.
Smell them, right? They had earmuffs on, so they couldn't hear them. They just had to find them with no vision and no sound. And they could figure out, just like, yeah, that's you. Yeah. Right? Whatever. Okay, hair and nail growth. Well, estrogen plays a role. Estrogen gives women a little different hair and also increased blood flow to skin. So one of the weird characteristics of estrogen, it makes your skin get more blood. And more blood leads to more hair growth because you're feeding the follicles. Yes?
What about like if you have increased cell activity, so you have more cell death too?
Yeah, so usually it's proportionate. For some reason, in pregnancy, the growth phase outlasts. That's why your hair falls out after you're pregnant. People think, well, I'm losing my hair. No, you're losing the extra hair you built. You're just going back to normal. But pregnant women will see that their hair comes out in clumps and they start freaking out. Well, no, you had extra hair here. They're going back to normal. How about changing libido? Yeah, someone kicking you. So same thing. As estrogen goes up, that changes the sex hormone ratio in your body, thereby causing a change in libido. Right?
Does it increase it?
Well, depending if you ask, yes and no. Usually, this is worthless shit. Only I would look at the study. I should get a graph of this. Sex drive trimester. You tend to see this. So what happens is in your first trimester, it's kind of off and on with the morning class. Right?
Thank you.
Second trimester, you tend to see an increase in sex drive until later when the belly gets in the way. And then it drops. And then as you get closer and closer to birth, sex drive goes up again, even with the belly in the way. And then it drops near the end, and then you give up. Right? So it varies. It varies. Yes.
It's no longer.
Right. So, breathing. Let's do this one. Why are you breathing faster but shallow? Let's find the baby picture again. Where's your diaphragm on this picture?
Nowhere.
Way up there. So my diaphragm has to drop to let air in. So if it can't drop as far, I have to breathe faster to get the same volume of air, right? Shallow and fast. So that's a diaphragm problem.
So it's not small lung capacity?
Well, not so much lung capacity, it's just you can't expand the lungs. So your lungs are still the same size, they just don't expand. Right? So, crushed lungs.
I thought you said crushed diaphragm.
Let's do crushed diaphragm. Either way, however you want to do it. Crushing the diaphragm does crush the lungs. Increase in blood flow to the skin. The glow of pregnancy mask. What makes your blood go up? That's the estrogen again. That beautiful glow is because estrogen's climbing, causing your skin to become more vascularized.
So what about all the waste products for the baby? Circulating for us, did we end up changing our breathing rate because of that extra?
Not enough to notice. It'll go up slightly, but the baby in proportion to you is so much smaller that you just overwhelm it. So you wouldn't see much. Make sense? So let's go down to those of you who want to do birthing neonatal delivery. These are some words you might see. Engagement, show, effacement, water, and all that. So engagement. What does that mean? Medical nursing people? Baby gets in position where? In your pelvis. To help you with these, I have an animation to show you. I show this just because as biologists I've had this fascinating that it works. You can actually give birth. Because there's actually about 7 different turns you and the baby have to do internally for the baby to get out. Because your pelvis and the baby are really not compatible. So the baby has to do a 90-degree turn and spin twice to get lined up to come out through your hips, basically. And it's fascinating. We call these the cardinal movements. Yes.
Was that you who said that?
I don't know.
I heard it.
I deny it.
The females today that our pelvis has grown so that as far as it can, if it grew it, if it was any bigger, that we wouldn't be able to walk like you're at the
That's kind of logic. Is a biped, you traded ease of birth for walking. That's why, I used to say before, but your dog go behind the sofa, right? Have puppies, right? You don't need to be there. No call. Because if you're a quadruped, you can make the vagina, cervix, uterus all big long ring and leave your hips this wide, right? So there's no problem. The minute you go on 2 legs, you can have a wide hips because you can't walk. So your hips have to narrow to keep them under your body. That makes it hard to give birth. So you traded birth for walking. So the baby is basically coming out the worst possible way, and you're walking and giving birth the worst possible way. You just happen to meet this bad compromise, which you do neither well. So if you walk better, you couldn't give birth, and if you gave birth better, you couldn't walk. And so you end up exactly lousy for both. That's why your Q angle's off. When we get knee injuries with the Q angle, that's all because of this. You can't put your knees under your hips because you couldn't give birth. Right? So only you were a cat, right? Anyway, let's watch this.
A number of changes occur in the position of the fetal head as it descends through the bony and narrow birth canal. These changes, called the cardinal movements or mechanisms, are engagement, descent, flexion, internal rotation, extension, external rotation, and expulsion. The movements apply to a fetus.
Hold on. So I'm never going to ask you, you're going to listen to this. Engagement is one of the ones you're supposed to know. It's one that comes up in nursing care is engagement. So let's figure out what engagement is.
It is presenting in a vertex presentation, an optimal presentation in which the fetal head is fully flexed. This is in contrast to other cephalic presentations, in which the head shows incomplete flexion or even full extension. Engagement occurs when the widest diameter of the fetal presenting part, the head in this case, has passed through the pelvic inlet. Note how the fetal head enters the pelvic inlet, which is widest from side to side. Descent, the next stage.
Go back to that. So engagement was what again? Baby's entering the pelvis. So that's what you're engaged, right? You're going to begin. So if we do our little list of what that is, engagement is entering the pelvis. Baby enters pelvis. If you remember your 231, the pelvic inlet, right, was the bowl of the funnel thing. Right, so baby's entering your pelvis. Baby, that's called sometimes called this the drop. The baby's beginning to lower down or drop into your pelvis. Right, but you're engaged. Right? So we'll keep going. Here.
Is the progression of the fetal head into the maternal pelvis. The degree of fetal descent is measured by stations. Station refers to the level of the presenting part in relation to the maternal ischial spines, which represent the narrowest diameter through which the fetus must pass. If the head is at station 0, at the level of the ischial spines, engagement has occurred. Positive numbers indicate that the presenting part of the fetus has descended past the ischial spines. Flexion occurs as the fetal head descends and comes into contact with the soft tissues of the pelvis, the muscles of the maternal pelvic floor, and the cervix. The resistance encountered with these structures causes the fetal chin to flex downward onto the chest. This position allows the smallest fetal diameters to enter the maternal pelvis. As the fetal head continues to descend, it must rotate to accommodate changes in the width of the pelvic opening. While the pelvic inlet was widest side to side, further down, the pelvic cavity is widest front to back. The next stage, extension, is underway.
Okay, so maybe we have a big jump there, right? But what did my cervix have to do here to get to that stage? Kind of open and dilate. So let's go back to our list. Right? So, when it opens and dilates, what do you think you might see if it opens and dilates? So the show, or showing, is what? That's the mucus plug. So you might see this kind of mucusy stuff coming out of the vagina. That's where the cervix opened, and now you get the show, or showing, mucus plug removal. Okay? So that means the cervix is opening. And let's do these words. Effacement, dilation, what part of the body is dilating and effacing? That's the cervix. That means the cervix has to open. That's where you get that 10 centimeter thing doctors quoted you. Right? So dilation means to get bigger. Anyone know what effacement means? It gets thinner. So you're opening the door and thinning it. So the cervix is to open and thin. Right? So your water broke. Okay, we're kind of there. What water for what? Whose water? Whose water is this? Let's find out. You see a water in there, anyone? Amniotic fluid, which is on the screen. There it is. Amniotic fluid. So the water breaking is the amp. We saw that in the video where they had the little bag. And put that back up. They mentioned the amnion, the amniotic cavity, the amniotic fluid. So I can't figure this out. Amnion. That's the amniotic cavity. The amnion breaks. Amnion breaks. So you broke your waters. That's what we're talking about. Crowning, we saw in the presentation today. What's crowning? That's the head out.
The whole head out, or even
well,
the
the top of the head. You can see the crown, right? That's the baby is here. Right. Let's finish our little innovation. Let's get this baby out of here. So far you've just extended, right? Let's keep going.
As the fetal head passes under the maternal symphysis pubis, it meets with resistance from the pelvic floor. The head pivots and extends with each maternal pushing effort. The head is born in extension, with the face directed toward the rectum. The next stage is external rotation. After the head is delivered in the extended position, it rotates briefly toward the position it occupied earlier in the pelvic inlet, realigning the head with the long axis of the body. This movement is termed restitution. As restitution continues, the shoulders align in the anteroposterior diameter, causing the head to continue to turn farther to one side. The fetal trunk moves through the pelvis with the anterior shoulders descending first. In the next stage, expulsion, maternal pushing efforts bring the anterior shoulder under the symphysis pubis. Lateral flexion of the shoulder and head occurs, and the anterior, then posterior shoulder appears. Once the shoulders are delivered, the rest of the body quickly follows.
I think it sounds too easy, don't it? Sense? All right.
Yep.
So let's go back then, and let's find this page in your packet. So now we kind of figured out how babies are reported generally. My public service announcement episode is this one. So it's going about these keywords, teratogens, teratogens, by the way. Let's see what those are. These things that cross the placenta. So they cross that interface. And they cause damage. So you call these birth defect things, but the fancy word is teratogen. Right? So if you're reading a label that says teratogenic, that means it can cross the placenta and then enter the baby's blood system and do something bad. So we have this magic chart that you're supposed to comprehend. So Let's figure out what we got. Okay, so 2 weeks, embryo, right? Week 3, fetus, week 9, form over here, right? What did the black bars indicate? Major problems. Missing parts, wrong part, not working part. So something is very wrong with you. The grayish color, like this kind of color here, that's sort of not so bad, or you could live with it, kind of damaged. So you have the part that just doesn't work quite right. So you got bad, and bad but not so bad. Okay? Then the white, what do you think the white represents?
You're okay.
You're okay, or no effect. So different parts of the body are affected at different times. Right? And if I know what you're doing and when you did it, I can figure out what body part you're going to damage. Or if I know the damage, I can guess when you partied. Right? Because this chart is pretty much the same for most people. So if you look at the chart, when are most of the bars black? What period of time? Embryo period. Right? Why would that be? Why would the embryo period be dark bars? We're forming. Remember that folding thing I told you to do? Right? So you're taking these layers and you're folding them and then building organs. So if I screw up the fold, if you're ever playing it the first fold wrong, the whole thing's wrong, right? That's the logic here. If I mess up the organogenesis early, I'm going to mess up the whole organ. The parts will be in the wrong place. So major abnormalities tend to be in the embryonic period. Once you get past building organs, notice the color. What happened in my fetal period? Is it bad?
Not as bad.
Not as bad. Jesus already done built you. Done built you? Is that even a 7? Right?
You've done
Done built you. That's how it does, right? So once I build it, it's harder to cause damage. Once I've already formed the part functionally.
Sorry, what did you say the white part was again?
No effect or no damage.
Okay.
Right?
Wasn't there a thing in like the 60s where women that in their like
Yep, there's actually under. So let's do everyone together. Let's suppose you took warfarin Coumadin from last term, the blood thinner. During the first trimester, is the first 3 months, which is roughly 12 weeks or so. Okay? What's going to happen to you if I take a poison during the first trimester? My baby will major problems everywhere, right? Every system would be affected at some level, depending on exactly how much and when. Because if you're building the part and I mess that up, right? So it's like building a house, right? If the foundation's off, every wall's off. You can't correct it very well. So let's say you decide to take the Coumadin in the second trimester, which is basically week 12 onward to 24. What about then? Is it still bad? It could be bad, but it's not going to be as bad because the lines start to change from black to gray to white. So if I was taking warfarin later in pregnancy, I'm not saying do that, right? But if you were exposed later, you would potentially do less damage because you've already formed the parts. So the take-home message of this chart is early is always worse than later. Now, if you're going to party, don't quote me on this, right? But if you party at 9 months, there's less damage than partying at 1 month. Because the bars are almost all white by the time you get to month 9. But the irony is you may have been pregnant while the partying went. Right? Let's do that. Number 2. It's your job. Thalidomide periods report no limbs and ear defects. I want you to look at the chart and tell me when people took thalidomide, which is your question. When?
It was early, right?
The loss of limbs would be major, and it's the black line. Let's see. Limbs, upper lower limbs are black from week 4 to week 8.
Same as the ear.
And then ear is 4 to about 16. They overlap between 4 and 8. Right? So when do people take thalidomide? Weeks 4 to 8, 1 or 2 months in. As for morning sickness, you get morning sickness your first trimester, you pop thalidomide, babies are born without limbs, and later on they figure out it's because of those 2 black lines there. Right? That's the logic of thalidomide. If I know the damage, I can see when you took the drug. Make sense? The logic? Okay, your job is number 3 then. You have malformed palate, would you have a heart defect?
Probably. About 6 to
I don't know, you tell me, future pediatric nurses.
9. Well, you only have 1 week to do all that stuff.
Yeah, you would.
See, malformed palate would be palate, roof of your mouth is black from what, 6 to 9, a little bit gray. And what am I looking for? Heart. Heart is black from 3 to 7 and gray to 9. So there is some overlap, right? You have a black overlap in week 6 and a gray to black in 7 and 8 and 9. So there is some overlap. So could that happen?
Yeah.
Yes. Can you be sure? Maybe not, right? Because it depends on which week specifically and how much. So it's like Vegas. I know the chances of this happening. I can't guarantee you're going to win or lose, right? So there is a potential you could have a palate and a heart defect together.
Is that something where, like, if they have a baby and it comes out with a palate defect, will they normally, like, look into his heart a little bit more? Or not really?
Not necessarily. There are diseases they call fetal triads, where if they see 2 of the symptoms, they can predict the 3rd, and then they'll look, right? But I'm not sure that this is a palate one of the dominant of a heart, but they might expect it. Makes sense? So let's do the report in. The body system is the most affected by teratogens throughout pregnancy. So notice if you look, it gets black on week 3, out of the gate, black to week 20, and gray throughout. Right, so why would that be? Why would your central nervous system be the most damaged? Right, there are a lot of neurons. It takes a long time to wire your brain. So your brain takes basically 20 weeks to build because of all the wiring and plumbing and all that stuff. So it's the most affected. Right? So if you look at also just as a side note, if you look at the way the bars start, it tells you when the organs are being made. So remember, when you start building them is critical. So you start building a brain week 3. When you start building a heart? Week 3. Why would you need a heart week 3?
Because it's essential.
Right, I have to transport fluids, right? At some point, I need a pump. I'm going to start building an airway. Well, I don't use my lungs, I need to get the plumbing in. So things we call come online. Things come online in sort of this manner of importance. So my brain part first, limbs, eyes, and ears a bit later. My teeth are a little later. My genitals I don't need much at all. Right? So you can kind of build a person in this pattern. Right? So let's do the rest of number 4. What are some things that affect the CNS during pregnancy? You've heard of one. Alcohol, fetal alcohol syndrome, right? The majority of mental retardation in the United States, they think, is due to that. Alcohol consumption while pregnant.
Not having enough folic acid.
Folic acid, spinal defects, right? Folate, spina bifida.
Which is why I don't understand when ladies are trying to get pregnant and they still trying to try. I've seen that.
Well, yeah, it's America. People do a lot of weird things.
At week 1, there's like it could happen to every single lady.
Yes, it could.
Did you see that?
Yeah.
Yes.
Is alcohol not necessarily, I mean, I know that it's very bad for the baby, but how come there's so many people who don't know that they're pregnant and they drink just like normal and the baby doesn't? Like, is it not as harmful as obviously it's not as bad as something like thalidomide?
We don't know.
It's not sharing. I don't really share it with others. That's all you have?
Well, the alcohol does transfer across, though. Diffusion. So they did study in Europe. If you think about Europe, right, everyone drinks wine all the time. When you're pregnant, you drink wine. That's not unheard of. They try to figure out how much drink. I hit get my side talk. Is there a magic level to where you can drink a glass of wine? And they tried to figure it out. And they couldn't get a number because it doesn't appear to follow a dosage-dependent term. So what that means is having 1 glass and going to 2 glasses doesn't mean you're twice at risk, right? So in the U.S., the American College of Pediatrics says no drinking alcohol ever while pregnant because they're sort of hedging their bet. In Europe, your doctor actually tell you have a glass of wine with meals. Right? One of the differences they think is cultural. Americans drink to get drunk. Europeans just drink to eat. And they think part of it is just how much alcohol you do when, rather than the amount. But no one can pick because that's an unethical. How do you ethically test fetal alcohol syndrome besides giving pregnant women alcohol and see if their babies are screwed up? That's not an ethical decision. And rodents process alcohol differently than mammals do. So you get this problem of how do you test it? So there is no one answer. No one can tell why some people drink all through the pregnancy and everything's fine. There is no good answer for that. Same thing with smoking, drugs. Right?
It's always like a silly question, but on the news you hear about people like, I didn't know I was pregnant.
Right.
What?
Yeah.
Like,
I didn't know going to class would improve my grade. Yeah, I heard that.
Yeah.
Right. It seems like just denial to me. I mean, I don't know. You really didn't know this was in there at some point, right?
You didn't know that you weren't bleeding tonight?
Yeah, I understand the concept. Hey, hold on, before you leave, we have one more thing to cover. Don't go yet. Don't you dare go yet. That doesn't hurt.
If you're really super overweight, you might have a strange period.
Just prior to birth, high levels of placental corticotropin-releasing hormone stimulate the production of more estrogen. As the level of estrogen surpasses that of progesterone, uterine contractions are no longer suppressed.
Remember, one of the jobs of progesterone was to hold your uterus and keep it still, they call it calming. So now the estrogen is climbing higher and higher, the progesterone can't keep your uterus calm, they call it, and therefore your uterus now starts to get more
Of estrogen
sensitive.
cause gap junctions to form in the smooth muscle cells of the myometrium, allowing the muscle cells to work in a coordinated fashion during labor. High levels of estrogen cause an increase of oxytocin receptors within the uterine muscle fibers. Since the oxytocin stimulates myometrial contractions, the increase in oxytocin receptors triggers the uterine muscle fibers to contract. The overall result of increased estrogen and oxytocin is stronger contractions as the time for birth nears. Like other placental hormones, relaxin levels rise during pregnancy. Relaxin helps to dilate the cervix and increases the flexibility of the maternal symphysis pubis. The overall result is to allow expansion of bony pelvis to make more room for the delivering fetus. Labor preceding childbirth is an excellent example of a positive feedback loop.
We almost got through an entire photograph.
So we're going to make a graph of contractions over time. So we're talking about uterine contractions, myometrial contractions. So we're going to first walk through this animation, see the process, and then we'll do a graph.
Centralize the controlled condition. The stimulus that starts the cycle is contractions of the uterus that moves the baby's head into the cervix.
Okay, so start putting these steps and we'll fill in the graph. So, remember your homeostasis, there's three things, right? There's a sensor. What was the second one? Controller. And the effector. Okay. So to do homeostasis at birth, I'm going to need three things. So, my baby's coming on down, and now I'm in the cervix. I'm in the gateway. Open the door. Let's see what happens.
When the baby reaches the cervix becomes distended, stretched. Receptor cells detect the stretch and change in the controlled condition of the cervix.
There you go. So what's the sensor for birth? The cervix. Your gatekeeper is getting upset with you. Somebody's pushing on the door. So the cervix begins to detect the baby's pushing. Right? Sends a message to the controller, right? What's the controller in labor?
Brain.
It's the first thing of class. The brain, right? Let's figure this out.
And send impulse signals to the brain. The impulses received from the nerves in the cervix trigger neurosecretory cells in the hypothalamus to secrete and release the hormone oxytocin.
Okay, so remember the hypothalamus is my controller. Or you can say brain, I'm okay with that one. The hypothalamus then says, great, there's a baby in there. I'm going to release oxytocin. Remember from 232, oxytocin was the neuropeptide hormone, right? Posterior pituitary stores it. What was the target of oxytocin? Targeted what? Uterine muscles. So my uterus, uterine muscles. Myometrium
How many times?
is going to make my uterus contract. So, if I contract my uterus, that's going to put more pressure on the cervix, right? Which is going to tell the brain there's more baby. The brain makes more oxytocin, which makes you do what for contractions?
Contract more.
More contractions.
Positive feedback.
Which puts more pressure, more oxytocin. Hey, my graph keeps going up. Therefore, it's positive feedback. Every change causes additional change, moving away from set point. Right? So hence you begin in pain and you end up in excruciating pain. Right? So let's do that.
Oxytocin diffuses into the blood capillaries of the pituitary gland and is transported to the uterus. Oxytocin stimulates the smooth muscle tissue of the uterine wall to contract more forcefully. These more forceful contractions push the baby further into the birth canal, stretching the cervix more, and triggering the stretch receptors to send more impulses to the hypothalamus. The self-amplifying nature of the positive feedback loop is repeated over and over with increasing intensity until the baby is born. After the birth of the baby, the stretching is halted and the positive feedback loop ceases.
So on the graph, the doctor's making other timing contractions that are stronger, faster, closer together because your brain and your uterus keep yelling at each other more and more and more. Okay, that's positive feedback regulation. Make sense?
So does that mean that women that are in labor for like really crazy long periods of time end up just like a constant contraction?
To a point, but what happens is your muscles eventually get tired, they fatigue, and then eventually you just, like they mentioned exhaustion, you just physically just can't keep contracting forever. But the goal is the same. The brain keeps yelling for more contraction until the baby comes out. So it just keeps screaming, cause tetanus, basically. Make sense?
That's fine.
And when pregnancy doesn't receive, or birth doesn't receive oxytocin, sometimes they give you oxytocin.
Yeah, if you give it Pitocin as the artificial version, I give you PIT, okay, everything contracts. Okay? You induce labors, you give Pitocin. Okay, anything, Megan?
Yep.
All right. So study your study again next week. Lactation.